Hello, my name's Valerie Daniels, and I'm with the SAAO Executive Council. I am the National Coordinator, and today we'll be doing an Osteopathic Roundtable interview with Dr. DeStefano. If you'd like to introduce yourself.
Hi, everyone. I'm Dr. Lisa DeStefano. I am the chair of the OMM department at Michigan State University, College of Osteopathic Medicine.
Okay. So we have a few set questions, the first of which is, what was your first experience with OMM?
Boy, my first experience with OMM was probably in medical school. I did not really expect to be an osteopathic physician when I was going through college. Um, my first understanding of osteopathy wasn't until I was a junior in college.
Mhm.
So I didn't really have an enlightening experience with OMM until well into my clinical years.
Is there a particular experience that kind of stands out in your mind as to when you kind of first caught hold of OMM, or not in particular?
Not in particular. My experience is my world is a little different. When I went to medical school, I really wanted to do hands-on medicine, but I didn't want. I wanted to do it in a functional physiologic way. I didn't really have a good understanding of osteopathic manipulative medicine. When I was a kid, I fractured my spine, and so I had a lot of experience with chiropractic.
Oh,
And
wow.
I always had this wonderful relationship with this gentleman who would teach me that if I ate popcorn, then it would mess up my sphincter of Odie, is what he would say. And so then I would have more back pain. So he would tell me some things that would help me see that there was a structural and functional relationship. So he wasn't just a simple chiropractor. So when I was a college student, I really loved chemistry. I loved science. When I went to college, I really just wanted to do more biochemistry and physiology. So I chose to be I wanted to be a chemical engineer. So I got to Michigan State and I started to become a chemical engineer and failed miserably because I really couldn't do the theoretical component of mathematics. It just didn't work for me. PChem, you know,
Yeah.
physics, those kinds of things. But I could pull a protein apart and put it back together. So, but I really loved function. My passion's always been function. So I loved the concept of if we improve the function, we improve the patient. So my experience with OMM was a slow revelation as it related to that passion and just function itself. So I studied a lot of the basic sciences and just kind of understood more of the ways in which we can influence that function. And so now, when I started in medical school, I really didn't get involved with OMM until I met my first husband, and that was we met in church, and he was the only person I ever knew that understood when I said I was an osteopathic medical student. He knew what I meant. He actually worked in the College of Osteopathic Medicine, and he co-wrote John Upledger's first book called Cranial Sacral Therapy.
Oh,
So
wow.
he introduced me to John Upledger. So my first experience with OMM was as a first year medical student, soon to be a second year medical student in at the Upledger Institute, learning cranial from a cranial sacral perspective. So
Thank you for sharing that with us. Um, what would you say is your most unique or bizarre treatment that you've had to develop for a challenging case?
I don't know that I've had to, you know, it's I don't know of anything that really sticks out in mind.
Or
When
like
you
an
know,
adaption for maybe somebody wheelchair bound or with a physical limitation? Anything
With
like
children, more than anything, with infants, trying to get after a dysfunction when a child is trying to run away from you and escape you,
that?
or a child that is, a 2-year-old that you have to do an interoral technique and you're trying to figure out how to gag the child long enough to get the work done. So some of those experiences come to mind.
Would you have any advice for anyone trying to wrangle a child for a treatment like that?
The funny thing about it is I do a lot of, I just default to myofascial release because I let them put themselves in a position of, I let them activate their own release.
Great. Okay. Well, our last question is, who is your osteopathic hero, if you have one?
I love Phil Greenman. He's my osteopathic hero from many perspectives. Because he was a standard setter, and I'm a very structured, organized in my mind. I'm kind of structured and organized, and so he made OMM and OMT very logical to me and rational to me.
Mhm.
And so he set some standards. He wrote a lot. He was very meticulous in the way that he would approach the physiology and diagnosis. And then he left a lot of room for of the more esoteric kind of thought process and the theory as well. So he did never criticize that. He just always took he took a little bits and pieces of what lots of people thought about as far as physiology of the musculoskeletal system and put it together in a real concise way. Um, a lot of his readings, if you read a lot of what he would talk about, his mentors were not necessarily DOs. A lot of them were MDs, a lot of them were PTs, physiologists, physicists. So he needed to understand the musculoskeletal system a lot better before he could understand how to treat it. So that's why I loved him.
Thank you. Well, those are all of our set questions. Is there anything else you'd like to share with students in the program or people going into OMM?
OMM is a wonderful profession. I don't know um, of a better. I'm so fortunate, and I feel really blessed to be able to do, see patients every single day.
Mhm.
And we have a very large OMM clinic at Michigan State University. We take insurance. We see patients in a way that I think is really rational, even for a primary care physician who wants to do a lot of OMT and OMM. Don't follow your passion. There's a lot that can be done. When we look at value-based medicine and the future of where medicine is going today, um, musculoskeletal care is really right up there. OMT and OMM is um, is very cost efficient, effective. We have to understand that knowing osteopathy allows you the freedom to give your patients a lot of reassurance. Doing the physical exams that includes the musculoskeletal system, really being creative with your physical examinations will save you money, save the healthcare dollars, and that's really the future of medicine is cost, right? Having low cost, efficient, effective care, and low cost, effective, efficient care. OMT is right up top there. So
All right.
hang in there, enjoy.
Well, thank you very much for speaking with us and your involvement with the SAAO this year. I hope you have a great rest of your day.
Thanks, Valerie. Appreciate it. Bye now.